impacts on the state's economy and businesses. For more, joining me live now is a federal member for Higgins, Katie Allen. Katie Allen, good to see you. How is Victoria at the moment? This is your fifth lockdown. We know that there are financial supports in place. Does it look like it's enough at the moment?
Look, Laura Jose, it's everyone's very frustrated in Victoria. It is our fifth lockdown. This has been such a long time that we've had to deal with so much uncertainty, and I think people are kind of very over COVID. But then you see those scenes from overseas where they may be ahead of us with the COVID vaccine rollout, but it's clear that it's not necessarily, the silver bullet. We're going to have to keep working with how to deal with COVID and how to deal with making sure we can get as much freedom back as possible.
Yeah, looking at the UK, what is your sense of what is happening there? This is really the test case, isn't it? 80% of people in the UK have had at least one jab, but when you look at those older cohorts, I mean, those in their 70s and 80s, they're almost 100% vaccinated. And we're still seeing a level of hospitalisation and a level of death. What does that tell us about the reality of the situation and the medium to long term here in Australia?
I think it's very sobering. And in fact, we've always in Australia been very careful to look to the rest of the world. So with the HIV/AIDS epidemic, we looked overseas, learnt the lessons of overseas, and then made sure that we did it better here. And I think we're seeing that with COVID. We have an opportunity to look at the UK, look at Israel, look at the US, learn the lessons there and work out where our future lies. So in the UK, they used AstraZeneca as the backbone of their vaccination program. In Israel, they've used Pfizer. They've got similar rates of double jab outcomes, so around sort of the high 60s, early 70s for the UK and Israel. They're hoping to see it higher. They've got first single jab outcomes of around 80%. And so we can look at those numbers of looking at the two different types of vaccines, which one's going to be the best at protecting from deaths, because that ultimately has always been what the vaccination rollout is about. We are seeing a disconnect in the UK between the number of cases and lower amounts of deaths. So they're getting a third wave of cases, but they are definitely getting low deaths, but they are still getting deaths. And the middle ground there is whether they're overwhelming the hospital system. And so you might have a number of cases, but if the hospital system's overwhelmed, that has an impact on other hospital aspects as well.
Yeah.
Of course, we want to keep death rates as low as possible.
Dr. Katie Allen, I should have called you at the start of this interview. I mean, if we look at the situation that we're in at the moment, half the country is in lockdown, two of the biggest major cities, the economy is on its knees, it's supported by government payments. What is the reality? What would you like to tell people as a medical doctor about the realities of living with this virus in the next 6 to 12 months?
That is a fantastic question, and I think that the situation as it emerges, the PM has always been very clear. This is a dual crisis. It's a health and an economic crisis. It's about lives and livelihoods. He's also been very clear from the start. We're going to have to learn to live with this virus. He's also been very clear that it's about aggressive suppression. So my view, we now have this Delta variant, which is much, much more infectious than the previous variant. So I was always a big supporter of using contact tracing to get on top of the outbreaks, the expected little outbreaks that we get, the rare outbreaks that we get from quarantining. But unfortunately, the Delta variant means that even contact tracing, the best contact tracing we've got in the country, which is in New South Wales, is being overwhelmed. And that is because by the time contact tracers get to the cases, they've already infected other people because it's a very, very infectious variant. So it's overwhelming contact tracers. So unfortunately now we need to use go hard, go early, short, sharp lockdowns in order to be a circuit breaker so the contact tracers can catch up. And then we need to make sure vaccination coverage is as high as possible so that we can get away from using lockdowns and be able to use the vaccination coverage to be able to help open up. But we need to have a conversation about the fact that when we open up, we will get COVID cases and unfortunately we will have fatalities. And that conversation is hard when we've done so well with aggressively suppressing COVID here. So I'm very much about I prefer us to use contact tracing and hotspot lockdowns rather than statewide lockdowns. But at the moment, we need circuit breakers because this is such an infectious variant. But we need to start having a conversation about what our targets for vaccination will be, but more importantly, what our acceptance of risk will be. And we know in this country we've already had a large amount of vaccine hesitancy driven by the very rare side effects, the very rare unfortunate fatalities that can occur from the COVID vaccine. It's a handful of COVID fatalities from the vaccine, even if we rolled it out, these vaccines out fully. But the risks that we're looking at if we open up will be many more cases and potentially many more deaths, even with the vaccination coverage that we're hoping to get. So we need to start having this sobering conversation about what is acceptable, how are we going to open back up, stop lockdown statewide, and opening up internationally. Those two conversations need to be had hand in glove between the federal governments and state governments, but we need the community to understand what the risks are and how we can make sure we can get back to a more COVID normal life.
Okay, well said, Katie Allen. We'll check in with you soon. Thanks so much.
Thanks so much.